Hi everyone. Ooh. Hi everyone. Welcome to Center of Balance Live. I'm Szenan from Center of Balance, the acupuncturist. Today is Saturday. Our topic today is stress and infertility. Stress and infertility. This is our topic. Now, last night in the Chinese platform, we talked about acupuncture in Chinese medicine to treat migraine. The case study, and I show everyone how I treated with Chinese medicine and acupuncture. And 8 o'clock at night time in my time, New Zealand time. In general, at 8 o'clock I do Chinese. I do live video in Chinese. Then now I actually last night I do it on. So I didn't have time to do live video because we did that Monday free webinar case study, right? So tonight as well. Tonight is in English, 8 o'clock my time. 2 hours. We talk about acupuncture in Chinese medicine to treat migraine, right? A case study. So which means I won't be able to do a live video in Chinese again. Now what we're going to do is, since my live video, the morning and night one are the same topic, so I don't want to tear apart. So I'm going to talk something different in today's live video. So we keep the male infertility treatment for tomorrow morning. So tomorrow night I can do the Chinese one, the same topic. So today we're gonna talk about something related to infertility that is so related to it's about stress. So it's about stress. Okay. So when it comes to fertility treatment or infertility treatment, stress is the biggest concern. It's the biggest concern. I never heard of any patient or anyone saying that, wow, we're so happy and relaxed because I can't get pregnant. No, there's no. Hi, goodness, Porter, how are you? Thank you. Good morning. Happy day. Good morning. Good morning. Good morning. Thank you for being here with me. So when it comes to infertility treatment, stress is one of the most factor that causing infertility, as well as make you worry, you know. And it go to a bad cycle. When you're more stressed, less it will lower down your fertility rate. So we're talking about, again, when it comes to treatment, we're talking about to increase your chance of pregnancy. Okay. Now when it comes to PMS symptoms, we say lower your PMS symptoms, and the chance of pregnancy will increase, right? So again, if there's many factors to lower the rate of pregnancy, right? Your chance of pregnancy, you want to increase it. Let's say if you lower your stress level, that increases a bit. If you lower your symptoms of PMS, like in general, if you're very stressed about it, if you lower that, and if you even lower the pain or clots or migraine while you have your period, tummy pain, bloating, so that chance of rate of pregnancy it increase a little bit more. All right. If you eat healthy, your life quality, your food quality increase, and that increase too. Okay. Something in the factor is some of the factor it decrease and that increase. Some of the factor that actually positive that the quality of life increase and that increase. That makes sense? Some people don't drink water. If you drink enough water, that increase. Make sense? Some people sleep quality is very low. If you improve your sleep quality, that increase again. So many factor like PCOS. If you're PCOS, you decrease the PCOS symptoms, and that increase. If you have fibromyalgia, pain all over the body. Now in Western medicine, they don't care about the other symptom. Sometimes not so care about the other symptom because they are too focused on infertility treatment. This part is other doctors' job. But for my job, I'm not other doctors. You know, we are reproductive acupuncturists. We are fertility acupuncturists and Chinese medicine herbalists. Then what makes me different with the others is we look at the full body. We look at the whole body that related to the organs. We believe that the muscle control entire, no, the spleen and stomach control the entire body muscle. Now, if you have muscle pain, which means the stomach and spleen function slower. Right? If you get anxious, which means your stomach and spleen function slow, because that's why you get anxious. Does it make sense? So to lower down your worry and anxiety, that increase the stomach and spleen function. When your stomach and spleen function better, whatever you eat, quality food, right? The food that you eat, the stomach and spleen can absorb and turn it into blood, bring the nutrient into the blood. So it can nourish all the organ. It can nourish the worm, your uterus, and supply the blood flow and nutrient to the ovaries to produce eggs, you know. And when it turn into those nutrients through the stomach and spleen, it turn to blood, and the blood can go into your uterus and to form lining. We talk about lining is important. Lining is for the embryo to implant. So therefore, a very simple question we always ask our patient: how are your bowel motion? If the patient say, well, 2 to 3 times a day and loose, and then we need to improve this. If the patient say, oh, I haven't been to toilet for 2 days, 3 days, or even up to 7 days, then what do? We say, okay, if that's the case, we want to get your bowel motion out daily. When the bowel motion out daily, it means stomach and spleen function better. When the stomach and spleen function better, which means you get proper nutrition into your body. Makes sense? Then all these things, right, that increase the chance of pregnancy, to conceive. Every woman is conceivable, right? And that do the same in men and male as well, not just in women. Now, if you're sick, you haven't go to toilet for a long time, or you get diarrhea, that you tend to get worry and anxiety, especially for those diarrhea ones. A lot of anxiety, a lot of worry, and that doesn't help you. And you need to have a solution to lower your anxiety alone, right? So I always ask my patient, that's true. I talk to everyone like this. I gave the lecture last night. I say, well, migraine related to stress, same as in here, infertility. Doesn't matter where it is, female infertility or male infertility. They're both related to stress. And I will tell you all the disease related to stress. I'm gonna let you know how stress impact and health. Okay. Now, very simple. When people get stressed, what they do, they end up with pain. Shoulder, neck, or lower back pain. That's one of causing by stress. Right? You ask the patient, why are you having this pain? How long have you had it? I find it comes and goes. When I stress, I get more pain. When I run down, I get more pain. When it's too many work, I get more pain. When I relax, it's fine. So stress related. So why would stress causing pain? I think about it. This is a simple question, okay? When you what in the face, okay? Look at my face. When you're stressed, do you do this? Tense up. Or when you're stressed, you do this. This is relaxing. Stress, you tense up. You know, all the muscle is just tense up. You know, when the muscle contraction, well, muscle contraction in here, we need muscle contract to push the blood out, right? Yeah, this is what how heart doing. But in this contraction is different. The heart contraction is contract, relax, contraction, relax, squeeze, relax. So that helps the blood flow. Yes, we need the contraction. But with the stress, it's different. It makes your muscle tense up like this. It doesn't let go. When it tense up, the blood flow in here, the blood flow go to other way. This hasn't got enough blood flow. Unless it relax, the blood flow come back. When it tense again, the blood flow go away. It's just like you're holding your muscle in here. You push it, no blood in here, no blood in this area now. Less blood. You release, more blood come in. You tense it. You know what I mean? So that is why stress, it tense up. People get this because they're stressed. They can't relax the shoulder. That's why I get neck pain and shoulder pain like this. Does it make sense to you? So this is very, very important. So if you know this, then that is the pain and stress causing. Now, if you're stressed, if you keep getting, when you have stress, you have tummy pain, which means you haven't got enough blood flow into the tummy. And that's important. And we need to know that. So managing your stress is so important. Okay, now some words are bad in infertility, you know. It's going to the fertility treatment, right? Stress is very stressful treatment, to be honest. Especially when it comes to IVF, invasive treatment, because you don't know what to expect. But I tell you what, when people come to acupuncture, they feel relaxed. At first, they got stressed. Why is that? Because they don't know what happened. As they keep coming regularly, they feel relaxed and feel, oh, I love acupuncture. Acupuncture helped me relax a lot. You know, they lay in there, they can go to sleep with the needles. I never thought about going to sleep with the needles, right? Because we put very tiny needles. And research say when we needle patient, the needle effect is they produce endorphin. And endorphin is 10 times powerful than morphine. What does morphine do? Morphine make the pain go away. Morphine help you relax. People on drugs, on those uh, recreation drugs, they feel high, they feel relaxed, right? But morphine has the same effect, as well as endorphin. Endorphin is the natural endorphin that is good for you. We once say, wow, if I give you endorphin, you get more endorphin, and that is so bad for you, that have side effect for you. We don't say that. We so let's produce it in yourself, in your body, that's gonna be good for you. So acupuncture can produce more, help your body produce more, stimulate your body for produce more endorphin, and the endorphin can decrease the stress and make you relax. Now here are some quotes, typical quotes when it comes to infertility. People will say, "Oh, I know I can't conceive because I wanted too much." That doesn't help if you say that. I worry so much about building a bank account before I had a child that I want my blood body out. Because what does I say? When it comes to infertility, it does spend money. It's not cheap. So the financial stress is another factor that will impact in your fertility. Does that make sense? I felt so guilty about having an abortion that my ovaries shut down. I think I'm punishing myself. If you have any surgery in the past, abortion, then you feel guilty because you can't get pregnant right now. And that may be one of the cause. So for those who are a young girl, or you're a mom, and you need to let your daughter know, make the right decision, because it might impact in the future. Okay, and no judgment in here. It's just life. Unfortunate things happen sometimes. It's not something that you want, or a bad decision. you know we all did something wrong, so don't keep blaming yourself, because it doesn't help your stress. Okay, just look at the positive side. What can I do right now? How can I improve my blood circulation? How can I eat well? you know and how do I improve my life quality to increase the chance of pregnancy? There's a lot of things that you can do. So don't live in the get the thought, the guilty thought in your mind and drag you down. That doesn't help you. So go change your mind. The mindset is very important and powerful. And how do you change it? Read some book, go to some seminar, and get the right information. If someone's negative, you choose your friends. You choose your family members. You can't choose your family member, but you can choose less time being those negative family members. You live by your own now. You will have a family. You know, you can decide to not contact so much with those negative family members. You can choose to be who need to be your friend. Those positive friends. You need it, because if people keep telling you the bad thing and they are not supporting you, it adds more stress. So you choose your social life. Choose the right social life. It's gonna help you be positive. It's gonna help you less stress and increase the chance of pregnancy. Does that make sense? And people say, this is all my own fault. I never relax. I just can't. Yes, everyone can relax. There's a reason if you can't relax. You need to find it out. And there are a lot of solutions, thousands of solutions in there. The people out there teaching how to relax. How can you relax? Control your breathing. Because when you're angry, you see, that's angry. When you relax, you slow down. Just breathe normally. So control your breathing. It can help you relax. And there are so many classes out there, and so many people can teach you how to relax through breathing. Okay. So what else? So a lot of self blaming is a natural attempt to restore a sense of control. When you think about it, there's a quote for you. If I made myself infertile, I can undo the problem. Right? People will think of this. Yes, it can. If you blame all yourself, that increase your stress and depression, and you end up with anxiety. All those things. You need someone. If you stay in the house yourself and with your partner, I keep thinking, get out of the stress, anxiety, and depression. They may not help. You need some books, some strategy, some solution to help you to get out of it. Some people who can guide you, give you some suggestion, and then you practice it. Now we suggest Ho'oponopono method. If meditation help, go for meditation. If walking help, it can help you decrease, go for walking. If jog help, go for exercise, go for it. If watching a movie and listen to a music, choose the music, choose the movie topic. You want to choose a happy one and make you laugh rather than after a movie you keep crying even badly. So you don't want that happen. So stress related a lot of things, including infertility. And infertility is a big thing when it comes to infertility. Stress is rather important. Is I would consider this the most important thing that you can do it yourself without anyone. And you make the decision whether you want to do it or not. Yes, acupuncture can help you relax. But when patients come here, I said, you can't come here for acupuncture every day, can you? You can't. Things keep happening, keep happening. You need to change your mindset. When things happen, how do you deal with it? Do you have a solution to help it? That's why we suggest all our patients to go for emotional daily practice. In our clinic, I do it myself. It helps a lot. I'm not saying that I won't be angry, I won't be grumpy. Yes, things will be all okay since I do that. No, I'm saying that when things happening, I can't control it. When things come out, I think about, oh, okay, this is not good, and it made me stress, it made me worry, and I start to turn the mood into emotional daily practice. I start to practice my solution and decrease the anxiety, decrease the worry, decrease the stress, decrease the depression. Does it make sense? When I decrease all this, my hormone become better, more balanced. If you keep worry, things, stress, angry, anxiety, depression, your hormone is gonna out of place. And infertility, when the hormone out of place, it impact in the period, it impact in your ovulation. You find things will get worse and worse and worse. So it's important to look at your stress. It's important to look at your stress. Now, the let's put it in there. How does stress impact in your egg quality? It doesn't, right? It does. People will say, oh no, it doesn't. It won't impact in my egg quality because there is no such um, uh, test to show that stress actually impact of egg quality. But it definitely stress can lead to behaviors that cause fertility problem. For example, women may leave fertility treatment, harm their fertility through drugs, smoking, or drinking, avoid sex, right? Not follow the instruction for fertility medication or acupuncture, right? That's due to stress. But it actually, according to Chinese medicine, another way that actually stress can impact in egg quality, but not directly. Let me put it this way. The eggs produced good quality rely on good food, good nutrient. If you stress that causing your stomach and spleen out of balance, then you diarrhea every day. When you diarrhea every day, bloating every day, worry every day, the stomach and spleen function start getting low. When the stomach and spleen function get low, mean you're not absorbing the nutrient properly, and it can't turn to the blood properly, or your blood quality is getting less. When your blood quality is getting less, what left to support your egg, produce the egg? So the egg quality will be low too. So in Western medicine, it doesn't make sense to them if you have Western medicine mind that how stress impact with egg quality. As I say, it's not directly, but it make your stomach and spleen worse. Then you haven't got enough nutrition. When you haven't got enough nutrient in your body, you don't have the nutrient to produce eggs. Does that make sense to you? So to reducing stress is always a good idea during fertility treatment. Here are some suggestions. I mentioned about those already, but first, accept that you have no control over the past of the or the future. Yeah, you have to accept that. Whatever happened, you have that. Whatever happened in the past is already past. In the future, you need to face it, and you have a solution. As I mentioned, Ho'oponopono method, emotional daily practice that we use is Ho'oponopono method, and you may have meditation, you may have walking or exercise to reduce your stress, and do it. And how often do you do it? Daily, every day. We use Ho'oponopono method. You don't have to go out. Doesn't matter if it's raining. Doesn't matter if it's nighttime or morning. In the middle of the night. Doesn't matter whether you are on at work or at home. You know, you're on an airplane. You're on a car. You can do emotional daily practice. So we choose the emotional daily practice is very, very effective, and you can do it anytime, any day, anyway. That's why we choose it to introduce to our patient. Because meditation, if meditation work for you, you need to do it every day. But the short side of meditation is you can't do it anyway. You can't do it. For my understanding, you need to find a place to do it yourself, right? You have to spend time for it, just by yourself. But now more and more people do meditation just 1 or 2 minutes. They can do it. Just close your eyes and be in there. Doesn't matter where it is. So if you can't do it, you need to learn some technique, some other new concept of meditation, they can do it short time, 5 minutes, 10 minutes. My wife, my daughter do meditation every day, 5 minutes, 10 minutes. Doesn't need to be half an hour, an hour. That's for a guru. The guru do that. But what is your purpose? So you need to know your purpose. Now, that making a deal with yourself to live in the prison and deal with the diagnosis. Okay, so if you're diagnosed with any medical issues, then you have to deal with it. And acupuncture and Chinese medicine can support you in here naturally. No side effects with acupuncture. The only side effect, you may feel prick about pain. That's it. And you get used to it. And we have painless acupuncture technique for you. You can't even feel the needles. Right. Next, so choose to behave as if you are calm and optimistic. The brain will signal your body that extra adrenaline is not needed. Soon you will actually feel more calm and optimistic. It works. Make sure your partner and support system know that you are not to blame. Encouraging partners to become to come to the appointment and gather the real facts. Yeah, the partners. When it comes to fertility, it's a partner things. It's just not your one thing. So for those who partner refuse to treatment to face the fact, I'll tell you, this fertility treatment that I feel great to go forward. So I encourage my patient when it comes to fertility, both female and male, or whatever partner come in. Like gay people, they need support too. For both female or both father need to come in. We need to talk about the solution. You see what I mean? So now this day, infertility treatment is not just for a couple, a man and a woman. It can be for gay people too. 2 men, you need to come in. 2 girl, 2 female, you need to come in. You need to talk about what's the solution. And you need to support each other. Not causing another stress for the others. Now, some job is very stressful, right? And I can't ask you, hey, leave your job. If you leave your job, you have a financial issue. And how could you support yourself? Right? So now you don't need to leave your job to reduce your stress level while going through fertility treatment. Not until, unless you wanted to leave anyway, right? Otherwise, we won't come. Not any of the practitioner will come up with a solution and say, "Oh, you have to leave your job. You have to quit your job because it's too much stress." We will say, "Well, you have your job right now. How do you structure to reduce your stress? How do you reduce the time of work? And how do you work with your work environment, and get your boss to support you because you're too stressed out about it?" And you can talk to them, and so change the relationship to work on with your worker, something like that. Right. The other solution is, as I keep saying that, in the Harvard study, a total of just 20 minutes a day of laugh or play can decrease stress symptoms by 50%. You work for 8 hours, probably some people 10 hours, 11 hours, 8 hours of working. You spend 20 minutes for exercise, for play, reading some funny email, just there are a lot of short movie now that can help you laugh for just 20 minutes, that it can reduce your 50% of your stress symptoms. How good could it be? How bad could it be? So spend your time in some exercise to help you relax. That is important. And finally, stop. Remember, you are your own best friend. So stop blaming yourself and treat yourself to the same supportiveness, considerations, and respect you give to the others you love. Okay. So I just want to remind you in here that fertility that certainly causes stress, but you can manage it. You have the solution. You need to come up with a solution. Okay. Not everyone. You say that people stress about they still get pregnant and they still go through it. Yes, they are. They get stressed, they still go through it. They're pregnant, they go label, But you need to understand something. Stress level does impact infertility. When it comes to stress, when it comes to infertility treatment, it causes more stress, right? Then you need to change your mind. What is best for you, and what's the solution for this stress? Okay, and we are here to help you. Acupuncture, Chinese medicine, very good for stress. When it comes to infertility, and to be honest, the cost of acupuncture compared with IVF, much less, very, very less. Okay, IVF you have to spend about 15 to 20,000. That's not including the drugs. If you put drugs on it, in $1 they give you more. Okay, and it comes to how many frozen eggs. If you just got one frozen eggs, that IVF process, just one go of IVF process, then you may just end up with 15 or 20,000. And a lot of people actually go to the bank and finance it. With acupuncture and Chinese surf, you don't have to go to the bank and finance it because we are not there. So one acupuncture and with herbs weekly for us comes to about $800 a month. What? A month? If it's $20, you can go for one $20 that is 1 year and a half or more than that. You see how acupuncture can make you relax, Chinese can make you relax and get your organs better. We all know that we can't just click and make you pregnant. We have no this ability. We try to regulate everything. And guess what? A lot of our infertility patients, they come in with pain. I have stress and I have pain. I can't go to the toilet or get diarrhea. And with the fertility treatment, acupuncture, Chinese herbs, they go better with all this symptom. Now, with our treatment, we give a plan and normally costs about $800 per month. How cheap is that? It's not as expensive as IVF treatment. Okay, so the financial, of course, it's still costing you money. Not everyone can afford that because It all depends how much saving you have. It all depends in how much you earn, right? But certainly not 20,000 in a few months. Certainly not 15,000 in a few months. The 20,000 with acupuncture in Chinese, it can go for 1.5 years or up to 2 years, something like that. Okay, so it can probably up to 2 years, I think 20,000. So you have time, you know you're unhealthy and you're a lot of stress, then acupuncture and Chinese medicine, I think they are the best combination for infertility. And when it comes to stress, we are not just talking about acupuncture and Chinese medicine. As I mentioned, we figured out what solution best for you. And there's a lot of things that you can do. Okay. Now, if you like this topic, please give me a thumbs up and leave the message down there. And Veronica said, yes, it makes sense. Thank you. Then, please, if you're patient, check down there or up there, whatever place, depending on your Facebook or YouTube, or if you're on our website, look at this topic, then you can check on our website and call us. We have a free pre-assessment because you're probably pretty new to acupuncture and Chinese medicine. Don't worry. Call us, have a talk. Up to 15 minutes, there's no charge. Or we book you an appointment after 15 minutes. We call pre-assessment, there's no charge. And after that, if we think that we can help you, there's a chance that we can help you, then you fill in a form, you come in for initial examination, and normally we charge $120, and only for you for $40 an hour. So we go through the form and we make the diagnosis according to Chinese medicine and acupuncture theory. And we set up a plan, we give you a diagnosis, we explain what's going on with you, then we explain the what do you call it, the plan, what sort of acupuncture and treatment, how often you need it, and what other thing that you can do at home, a lifestyle change. When you talk about all this, then we'll give you the budget, the cost, how much it's going to cost for you. Does it make sense? So this is what we do in our clinic. So we are the fertility expert in acupuncture and Chinese medicines. We've been doing fertility treatment for the last 14 years, and we treat fertility patients daily. So there's something that we can help. If there's no solution for you, or they can't find any diagnosis, you're all fine, but you just can't get pregnant, and they should just IVF, and IVF we can support it too. We can do acupuncture to increase your chance of getting pregnant, going through IVF as well. Okay, that's it for today, and thank you for being here with me. If you're an acupuncturist, I hope this valuable for you to talk about this, to understand why stress is so important when it comes to infertility and how they deal with it and how to talk to patient about it. If you're patient, you need to know, we mentioned it all already, stress are the most common things across from the beginning to the end of your fertility treatment. Okay, stay awesome, and I love you all. I'll see you tomorrow. Bye bye, and I'll see you tonight if you're a practitioner. And tonight we have live webinar, free live webinar once a month, acupuncture in Chinese medicine to treat migraine, case study. See you then. Thank you, Veronica. Thank you. The mystery